Hello, my name is Matt Bowker, and I manage Rhodes Scholars Virtual Lecture Series, and it's my pleasure to host today's virtual lecture. So today's lecture is in collaboration between Rhodes Scholar and the Academy for Lifelong Learning at SUNY Empire State. The Academy for Lifelong Learning is a member of the Rhodes Scholar Lifelong Learning Institute Resource Network. And here we have Dr. Gerald Stulc, who is a retired cancer and trauma surgeon who served in the U.S. Naval Reserve's Medical Corps and retired as captain in 2002. Afterwards, he obtained an MFA degree in creative writing and is currently working on a historical fiction novel based on the Napoleonic Wars. He is a featured speaker at the Academy of Lifelong Learning Institute at SUNY Empire State College. So let's have a warm virtual welcome for Dr. Gerald Stulc.
Hello, everyone. I hope you are well and having a good day. Welcome to the Rhodes Scholar presentation for today on a topic from the book I'm currently writing on the history of military medicine from antiquity to the present. I'm going to tell you today about a portion of that book, which I'm writing, that deals with medicine and surgery during the latter 18th century aboard the British naval vessels that were called men of war. Now, these are the key points I want to tell you about because this is a topic that's near and dear to my heart because of my career in medicine and my service in the United States Army and Reserves for nearly 16 years. I've had a lifelong passion for the study of military and medical history, culminating in the book that I'm writing. Now, by the end of the 18th century going to the 19th century, England virtually came to rule the world's oceans, establishing colonies and mercantile trade, which required a strong navy to protect and police it around the globe. The naval fleets employed sail-powered ships and modern technology and weaponology state-of-the-art before the introduction of steamships. To keep the fleets healthy and at acceptable levels of manpower, medical care of the men was imperative. Meanwhile, the Navy in their global missions encountered exotic diseases initially, uncommon or unknown in Europe, and injuries, many of which were unique to the naval service, all of which the naval surgeon had to attend to. This is a crosscut of a man of war, the HMS Victory, specifically, which is represented in the model I have behind me. This was a 100-gun boat called a first rate. The boats were rated on the number of guns they had, first, second, third rate, and so forth. It's a world unto itself. It'd be in the middle of the ocean, having to be self-sufficient. The chain of command went something like this. The king and the parliament in England, of course, headed the government. The naval service branch was headed by the Admiralty, and the Navy board was the civilian sector that took care of the day-to-day activities. They had about a dozen departments under them, including the Sick and Hurt Board, as it was called, and the Prisoner of War Board. This took care of the medical matters. Each fleet had a fleet admiral, and each boat was commanded by a captain. There was a fleet physician that was responsible for the entire fleet's health. But on board each ship was a surgeon and his first and second assistants. And the number of surgeons depended on the rating of the ship. Like the Victory, being a first rate, had 3 surgeons and 2 to 3 assistants. They also had a nurse called a loblolly boy. There would be perhaps a dozen of these with no medical training, but somewhat akin to what we have as medics or corpsmen these days. Their job was to assist the surgeons and surgeons' assistants, and they would carry porridge called loblolly porridge to the sick and the wounded, therefore their names loblolly boys. There are also hospitals on land, such as Hassler Hospital outside of Portsmouth, and there are hospital ships. There was 1 physician in the Navy for every 8 surgeons, and 1 surgeon was responsible for about 150 to 250 men. Now, from the get-go, I want to dispel a common misperception among people that medicine and surgery in this era was crude, even barbaric. Some misperceptions that continue throughout the 19th century, including the American Civil War. Actually, medicine at this time was quite sophisticated and at the cusp of discoveries that came later in that century, such as anesthesia and antisepsis, with the theory of germs causing infectious diseases. Physicians, by and large, were well educated. The physicians had 4 to 6 years at a university medical school, and almost all European capitals and major cities by that time had medical schools. They came a little bit later in the United States. Their focus was on physics, which was the old name for internal medicine, anatomy, botany, and pharmacy. They would graduate with a degree in medicine and thereafter would attain a high social and professional status with a commensurate income. They would then join the Royal College of Physicians. And all European countries and subsequently North and South American countries adopted this kind of premise. With the surgeons, however, their task was considered more of a craft, a quote, menial trade, and therefore their social and professional status was lower. Moreover, there are few medical schools at that time that offered surgical courses and surgical degrees. The outstanding examples of that being in Scotland, where Edinburgh, Aberdeen, and Glasgow had renowned universities and medical schools that offered surgery. But even then, they would graduate with only a master's degree, not a doctorate degree. And that's the reason that to this day, surgeons in the United Kingdom, even though they're physicians and have gone through the same training, are called Mr. instead of Doctor. Now, if the young people couldn't afford going to a university to get a degree in surgery, they would go through an apprenticeship, which would last anywhere from 7 to over 20 years. Only after an apprenticeship with an accredited and certified surgeon did they then receive the ability to practice surgery, but they had to pass examinations before the Royal College of Surgeons before they could be licensed to practice. Now, on the naval vessels themselves, the conditions were even worse for the men and the surgeons. There were a number of grievances, including, particularly to the surgeons, low status and respect. They had no autonomy or authority. They had no officer's rank as surgeons and physicians, not even their own uniform. Moreover, they were paid poorly, even less so than surgeons in the Army, and certainly far less than surgeons in civilian practice, something that pertains to this day. The grievances not only of surgeons, but of seamen in general throughout the Georgian Navy, and it's called Georgian Navy because King George III was the king at that time, caused by 1795 global mutinies, some of which were quite murderous and bloody. The 15 top insurgents were hanged, but a number of naval surgeons were also involved in these mutinies. And because of their slightly higher status, reforms were promoted largely as exigencies because Napoleon was ready to invade England, and the Navy had a dearth of surgeons and physicians at that time. Few people wanted to join on, and many more did not sign up for re-enlistment. By 1805, the condition had changed markedly. A prominent naval surgeon, in fact, said before then, God knows there are no seductions to being a naval surgeon. The surgeon's pay was increased to be on par with the Army. The surgeon's mates were renamed assistants. The drugs that they carried on board the ship, which they had to pay for before this time, were now provided for free, and they received a distinguishing captain's uniform. Unfortunately, they still had to pay for their surgical instruments. There are no military medical schools established, and they were still subordinate to senior and junior officers. So why would these young men even consider entering naval medical service? Well, for many, it was the seeking of a better life. Many impoverished youth, particularly in Scotland, would find the wherewithal to attend a medical school, to get a degree, and then migrate south into London to start a civilian practice. But lack of opportunities in civilian practice caused many of these people to have to join the service. Then, as always, there were individual issues. Some people were simply incompetent and sought refuge within the Army or Naval Service. Others escaped civic responsibilities, such as marriage or prison or both. And then there was alcoholism, which has been a perpetual problem. Some simply sought a regimented life, a mother that would take care of them, tell them what to do, put them to bed, wake them up in the morning, and give them 3 squares a day. Others simply sought an adventure, being able to tour the world with the Navy. But by and large, the vast majority of people signed on to be naval surgeons out of patriotism. Now, there were a number of common illnesses, as I alluded to in the beginning, that were prevalent among the armies and navies of all nations. These included typhoid, typhus, which was called ship or camp fever, dysentery, which they called flux, scurvy, malaria, called ague, yellow fever or yellow jack, hepatitis, smallpox, as differentiated from large pox, which was syphilis, and therefore the oath pox on you doesn't mean smallpox, it means I hope you get the large pox. And then there's the other venereal disease, gonorrhea, which is extremely prevalent among sailors, and constant problem of alcoholism. A large, huge scourge of navies was scurvy, which you all know is a vitamin C deficiency. This was a horrible disease, and it occurred because the naval ships now were able to make global voyages, stay at sea much longer without benefit of fresh fruits or meats. And with that vitamin deficiency came a host of symptoms such as lack of collagen formation, leading to weakening of scars, weakening of the gums and loss of teeth, easy bruising and bleeding, poor wound healing, pain and swelling of joints, hair loss, and fatigue with consequent death. In the left upper corner is a picture of James Lind, a very famous naval surgeon who in 1754 discovered that lemon juice would be able to turn around the symptoms or prevent the onset of scurvy. And the Navy was slow to adapt this to the whole Navy, but by that point, when it was adopted around 1800, the sailors were given lime juice instead, and that's why to this day, British sailors are called limeys. As far as the typical injuries and surgeries aboard a ship, there are, of course, the falls from yardarms and topsails. There are lacerations, fractured bones, dislocations. And another common problem was due to gonorrhea that caused urethral strictures that had to be opened up with a metal probe. Not much fun. Inguinal hernias were also common, what we call groin ruptures in the common vernacular. And these would be common among young men subject to repetitive physical straining and lifting. That's part and parcel of life aboard a sailing ship. Most hernia operations were done on an emergency basis when a loop of small bowel would become entrapped in the sac, become incarcerated, and would lead to death if the bowel entrapped lost its blood supply, called an incarcerated hernia. Now I'm going to talk about a stellar example of all these illnesses and injuries. And the perfect exemplar of that is the famous naval hero, Admiral Lord Viscount Horatio Nelson, who lived from 1758 to 1805. I use him as an example because he had virtually all of these illnesses and injuries during his stellar career. Illnesses included chronic seasickness. Imagine a famous admiral being seasick every time he came aboard a ship, but he was, and he required peppermint to combat that. When he was a young man on a trip to Bombay, he incurred malaria and had recurrent bouts of malaria over the next number of years. While on a mission to Nicaragua to assail a Spanish fort there, he contracted a severe febrile illness that almost killed him. We don't know what it was. It may have been malaria, but we think it may have been yellow fever. For all of his life, he suffered from chronic paresthesias, which means intermittent numbness, paralysis, weakness in the left arm, and we, to this day, don't know the cause of that. And on a voyage to the Americas in 1782 during the American Revolution, he and the entire crew developed a severe case of scurvy, resulting in tooth loss, and in his subsequent portraits, Viscount Nelson is shown with sunken cheeks due to the loss of teeth. As far as injuries go, which I'll be discussing in greater detail, he sustained a sword cut to the back in 1794, a blast injury to the eye in 1794, later in that year, blunt abdominal trauma where a large splinter hit him in the belly in 1797, a gunshot wound to the arm that resulted in amputation later that same year, a severe forehead laceration and probable brain injury, and finally a gunshot wound in the Battle of Trafalgar in 1805 that took his life. Now, as far as the eye injury goes, this happened in 1794 at the Siege of Calvi in Corsica. He was trying to assault a Spanish fortress there when a cannon shot struck a sandbag near him, killing the man next to him and showering him with small pebbles, gravel, and sand. This peppered the right side of his face, causing innumerable small lacerations, a lot of bleeding, but one of these small pebbles or pieces of sand struck his right eye, injuring it. We don't know if it just glanced across the cornea of the eye, causing subsequent scarring, or whether it actually entered the eye, causing bleeding within the eye. Initially, you could only see light from dark with that eye. He never lost the eye, but from then on, the eye was scarred over, had a milkiness, as it was described, and had decreased vision, resulting in 1797, the company of surgeons examining him and accepting his petition for damages occurred to the loss of the eye, so he was given money for that injury. I must stress that despite all the depictions of Nelson, particularly in the movie That Hamilton Woman, shown down below, Nelson never wore an eye patch. Later that same year, in the Battle of Cape St. Vincent, he was boarding an enemy vessel, the San Nicolas, when he sustained a severe splinter wound from a cannon shot that struck a nearby wooden structure. This struck him in the right lower abdomen, almost knocking him over, save for a nearby officer that held him up from falling to the deck. He kept on fighting. He not only captured that vessel, but also the San Jose, becoming a national hero, capturing 2 enemy vessels within several minutes. However, over the next several days, he had considerable pain in the abdomen, and he could not pass his water. We think this was due to a large collection of blood internally, either around the bladder or within the bladder itself. Eventually, this resolved, but from there on, the damage to the muscles of the right lower abdomen resulted in a defect, a weakness that we call a large ventral hernia or rupture, which is shown in this illustration, where the weakness causes an outpouching that can entrap intestines like the groin rupture and can lead to death. Fortunately, this didn't happen to Nelson, but in 1804, he wrote to his paramour, Lady Hamilton, whom he had an affair with, "My cough is very bad in my side, where I was struck on the 14th February in 1798, is very much swelled. At times a lump as large as my fist is brought on, occasionally by violent coughing." Well, not much later than that, he proposed an ill-advised attack, again on a Spanish fortress on the island of Tenerife in the Canary Islands. The capital was Santa Cruz. He assaulted around 12 midnight from his jolly boat, and as soon as he stepped off the boat on shore, he was struck by a musket ball in the right arm just above the elbow, transecting and fracturing his right arm bone, the humerus, as well as the major blood vessel called the brachial artery. He would have died on the spot from bleeding if it wasn't for his nephew, who was next to him, Lieutenant Josiah Nisbet, who took off his silk kerchief and wrapped it around the arm as a tourniquet. He was rowed back to the ship HMS Theseus, where a young but very capable surgeon named Thomas Eshelby operated on him about 1 o'clock in the morning in the gloom of the operating room deep in the bowels of that ship. He was assisted by Louis Romanier, who was a French surgeon who defected from the French Navy to the English. This is an example of a cockpit. It's one of the lowest areas in a ship. It's below the waterline for the safety of the injured and the wounded. Being so deep within the ship, obviously the lighting was very poor, even with the horn lamps suspended above the operating tables. This is the actual cockpit, the operating room in the HMS Victory, which was the flagship for Nelson. You can see the instruments arrayed in the front. In the back, those lockers are where the surgeons and assistants actually lived. And on the right side is just a grim reproduction of what an amputated arm would have looked like. This is the typical surgeon's kit from a naval surgeon. At the top, you'll see the amputation knives and the saw for cutting through the bone. Below are clippers for clipping off the ragged bone edges if they exist. And below that is a trephine for elevating depressed pieces of skull from a head injury. Next to that, in the left lower corner, is what's called a petit clamp designed by a prominent French naval surgeon. It's a wide cotton band with a screw clamp on it that's wrapped around the limb above the area to be amputated. And with a screw clamp down on the artery, all blood flow is then shut off. Very effective instrument. This is from a series of illustrations by the prominent surgeon and artist, Dr. Charles Bell, in 1821, showing a typical arm amputation. Notice no tourniquet is used in this case, but simply pressure on the artery by an assistant. Well, following the amputation, which Nelson got through very well without, remember, anesthesia or antisepsis, and he did receive opium after this for his pain, but he still had severe pain in the stump for about 5 months. You'll notice in this painting done 3 months after his amputation that his right sleeve is now empty and pinned up against his jacket. He continued to have pain until just before Christmas of that same year, when suddenly a large silk tie was discharged through the wound of his right arm stump, immediately resulting in relief of pain. We conjecture now in retrospect that what happened was that in the urgency of operating on a famous admiral, in the gloom of this cockpit at 1 o'clock in the morning, this young surgeon included the median nerve, which normally lies just next to the brachial artery. He included that in the tie and tying off the brachial artery, in other words, a pinched nerve. And you all know how painful that can be. Even after relief of that pain, he had chronic pain and the sensation that his arm and hand were still present, what we call the phantom limb syndrome, very common among amputees. We still don't understand the mechanism, but now we have drugs like Neurontin to take care of it. Well, the following year, he was involved in the Battle of the Nile against Napoleon's army and navy, which were invading Egypt. He was struck by Landridge, which is a kind of cannon shot that just glanced his right forehead, causing an avulsion, a flat laceration that went down to the bone. He wasn't knocked out, but after the dressings that you see him incurring in the left upper painting, he had severe headaches that he called splitting headaches for the next 18 hours, and for the rest of his life had subsequent chronic headaches alongside depression, nausea, bouts of vomiting, and he probably sustained what we call a traumatic brain injury. In other words, injury to the frontal lobe of the brain with possible personality changes. We know this because he, from then on, was even more insubordinate to his seniors. He had this terribly scandalous affair with Lady Hamilton in Italy, in 1799, even though they were both married, and he hanged a rebel admiral named Francesco Caracciolo for trying to overtake the monarchy of Italy, which was totally out of character for Nelson to do. The subsequent portraits here show Nelson on the right side, where he was just bandaged and going on to continue the battle. In the left upper corner is a portrait that just barely shows the scar and the disruption of the eyebrow. The middle portrait is the interesting one. This was done by an Italian portraitist named Zardi, who made this portrait, I think, very accurately, showing how sick and ill and overburdened and stressed out Nelson was by this point. But more to the point, he shows this vivid, ragged scar above his right forehead with disruption of the eyebrow. Interestingly, several years after this portrait was done, another artist came along and painted over the scar and replaced the eyebrow. And this wasn't known until just last year, where an art expert did x-rays of this portrait and found the scar underneath the paint. And this is with the paint removed. Because Nelson was a hero, he had to be heroic. He couldn't have this ragged scar displayed in his portraits. Head injuries, otherwise, if they are severe, required a corkscrew type device called a trephine to bore into the skull fragment, pushing down against the brain, and to elevate that like a cork would from a bottle to help the injured survive. Now, by 1805, Napoleon was threatening to invade England, and the French army was lined up at Boulogne in France, ready to cross the English Channel. The combined fleet of French and Spanish ships were to protect that invasion from crossing, to help the invasion fleet from crossing the channel. And it was Nelson's charge to prevent that invasion force from crossing the channel by standing off against the combined Spanish and French fleet. During that battle, on a Sunday morning, October 21st, Nelson and Captain Thomas Hardy of the flagship Victory were walking the decks amidst all the gunfire, cannon fire, and musket fire. In the meantime, a French ship became entangled with the sails and rigging of the Victory. The French ship was called Redoutable, and it had marksmen in the topmast pictured on the right side. One of these marksmen, from a distance of about 50 to 60 feet, fired down on Nelson as he was walking the decks. Nelson was struck just below the left collarbone with the musket ball that entered his left lung, transecting the blood vessels and crushing the vertebrae, the 7th and 6th vertebrae in his back, transecting the spinal cord and causing immediate paralysis, as well as collapse of the lung and bleeding into the chest. In this portrait, which is rather romantic and somewhat sterilized for public viewing for that time and era, Nelson is shown lying on the deck just after he's been struck by the musket ball, with that red dot that I've placed on the portrait. He was taken care of immediately in the cockpit by an Irish surgeon named William Beatty. And Beatty, unfortunately, could do nothing for Nelson. The injury occurred a little bit after 1 o'clock in the afternoon. Both Nelson and Beatty knew that this was a fatal injury. Even today, the best we could do is resuscitate Nelson with blood transfusions and IV fluids and perhaps surgery on the chest and the lung. But we still cannot do anything about the paralysis from the crushed vertebrae and transected spinal cord. He died in this rather heroic painting representation, leaning against an oversized lower deck, surrounded by his friends and officers. You'll see that there's no evidence of a gunshot wound to his chest. Again, he was the hero. He had to be perfect. but he died around 4:30 in the afternoon, only after he had learned that indeed the English had won the Battle of Trafalgar. And his last words were, "Thank God, I have done my duty." This is the actual scene where he died, much, much smaller, aboard the Victory. This is now a memorial to Nelson. This is where he was actually leaning against when he died. And that's another view of the cockpit from the HMS Victory. It's much better lighted now by electricity. It would have not been anywhere near this bright in the actual times. So in summary and conclusions, I want to leave you with the ideas that the education and training of military physicians and surgeons was far more advanced, leading to a better, more sophisticated level of medicine than you might think. The status of naval surgeons was brought up considerably by necessary reforms during the Napoleonic Wars, but the surgeons still had to deal with a number of different diseases and injuries unique to the naval service. Indeed, about 85% of deaths were due to accidents and to infectious diseases and not actual combat. All this trauma care was often very successful, including the amputations and head surgeries, despite the lack of anesthesia and antiseptic knowledge. And these labors and dedication of these naval doctors and surgeons in the early 19th century led to the level of medical care that we now enjoy, not only in the military, but in civilian practice. Thank you very much for listening in, and I'm open now, Matt, to any questions.
Thanks, Gerald. Poor guy.
Yeah, I mean, he had everything happen to him.
Yeah. Okay, so just a reminder for those who would like to submit some questions, there's a Q&A on the bottom, a Q&A icon, and just click that and type your question in. We already have several questions from the over 600 people that are currently joined. First question is about the surgical tools. Some of these surgical tools seem so primitive. Are any still used today? And this is a question from Vera.
Okay, well, a modification of the trephine for elevating depressed bone skull fractures is still used. The amputation knives are not used so much anymore. We use scalpels. We have more sophisticated tourniquets. The raspers and the clippers for the bone edges are still pretty much the same. All in all, they're just more sophisticated variations of the same instruments.
Did you have to buy your surgical tools?
No.
Well, we have a question. How much would they have cost?
Oh, gosh, really, that's an interesting question. I have no idea. I think they got to keep the instruments when they left the service, but I don't think they were inexpensive because these were very sophisticated tooled instruments by master craftsmen. But that being said, I cannot give you an amount. I will try and find that for you.
This question is from Alice. What was the lack of surgeons' autonomy because they reported to the today's equivalent of a GP who made decisions?
I'm not quite sure I understood the question. Was the autonomy equivalent to a GP today? Or?
Can you comment on the surgeon's autonomy and the chain of command?
Yeah, well, yes, Alice, another good question. The autonomy of the surgeon was non-existent before the reforms. No matter what he said, the captain could override him, or even a junior officer. Even though a good captain would listen to the surgeon, not that that doesn't happen in today's politics, but the autonomy of the surgeon became markedly increased by these reforms that are pushed through by prominent naval surgeons and physicians by 1805, such that they could pretty much have a large say in how medicine and surgery and the health, the preventative care of the sailors was undertaken aboard a ship. So they received much more autonomy following the reforms. They were officers by this time, but even today in the Navy, even though I was a captain, which is one step below an admiral, I would still have to take orders from a junior officer who was a staff or service officer, who was a regular officer of the Navy, not a staff officer like a physician. So I had to even still be subordinate to a junior officer on board the ship.
We have several questions about anesthesia.
Yeah,
What was the status of anesthesia, and did they use rum or alcohol at any point?
boy, they sure did, even if you didn't have any pain. But yes, you'd get a good stiff shot of rum that was in the cabinet behind the surgeon. Um, the opium was used only afterwards because it took too long, and if you had to do surgery within the next few minutes, you couldn't wait for the opium for a half hour to engage in. The worst resort would be just simply to knock the patient out with a knock to the head with a belaying pin, but that rarely happened. Interestingly, this is my own hypothesis. Imagine if you cross your leg or lean on your arm for a long period of time, it goes numb, it goes to sleep. That's because you pinched off the blood flow to the nerve. And when you go to stand up, you almost fall over and you can't feel your foot for a few minutes. And that's because the nerve has become anesthetized from lack of blood flow. So when you apply this very tight tourniquet with a screw clamp on it, I hypothesized that within a few minutes, that limb went virtually numb just from the occlusion of blood flow to the nerve. Besides, in those days, people were much more used to pain and were a lot tougher than we are now. Nelson braved through his amputation without a word and then went back to command after his stump was closed with what we call steri-strips these days.
We have several questions also about medicine. Can you tell us about some of the medicines that were used, and what did they do for infections?
Well, interestingly, and that would be a whole lecture in of itself, they used a whole variety. They had perhaps over 300 medicines available to them, which were based on trial and error through centuries and centuries of folklore. That's my dog behind me. The common medicines included opium, as I said, quinine, what they called bark for malaria, ipecac for inducing vomiting. They had all kinds of cathartics and enemas to stimulate bowel movements. They did use wine in lavaging, irrigating wounds prior to closure. So they knew that there was a effect with wine as well as with copper, interestingly, which was known already in the ancient times that copper would decrease infection. There are a variety of medicines used for all sorts of things. Nausea, fever, et cetera, et cetera.
Thomas would like to know, what level of education did physicians have before going to medical school?
They did not have to go to pre-med. They would usually go through some kind of a cursory grade school through several grades. They usually entered medical school around the age of 15 or 16. And there they would also learn the classics. They would learn a little bit about astronomy, philosophy, etc. So they had quite a broad education. And I'll tell you this one thing, that by that time, the average medical school graduate, especially the surgeon, knew his anatomy better than the average medical student graduating these days.
We have a few questions about comparing and contrasting the British Navy and the American Navy in this regard.
Yeah, in general, the Navy or the medical branch of it?
The medical branch.
Okay. Again, many of the American surgeons and physicians took their training during colonial times overseas, particularly in England or in France, in Paris. So they had pretty good educations. Otherwise, they had apprenticeships, but they had the role model of the British Navy to go by, so that not only the structure of the American Navy, but also the medical branch of the Navy and the Army was structured after that of the British. And remember that the colonialists were British before the American Revolution. So it was pretty much on par, even though because they're colonials, the English tended to look down upon them. but we had some tremendous physicians and surgeons during the colonial period, American Revolution. Benjamin Rush is a wonderful example of that from Philadelphia.
Timothy would like to know more about scurvy and attempts. He asks, were onions also used for vitamin C, or what other options were available commonly?
For scurvy? Well, any fresh fruit or meat would provide vitamin C. It's just it was far more concentrated in fresh vegetables, particularly in the fruit juices. But the thing with vitamin C is it's necessary for collagen to build, and collagen is what holds scars together, what holds our connective tissues together. So if you have scurvy after several weeks of vitamin C deficiency in your diet, even old scars that are 20, 30 years old will open up on you because the collagen continually is recycled in an old scar. And if it's not recycled, that wound's going to open up. It's pretty nasty. So yes, there were any number of measures. And before Lind, even in the 16th century, some sailors already just stumbled across the idea of using fresh fruits to prevent scurvy. But it was actually established and proven by the trials of James Lind in 1747 to 1754.
We have a question, just a few more questions.
Sure.
William would like to know, did the reputation or career of the surgeon treating Nelson at the time of his death suffer because Nelson died on his watch?
No, just to the contrary. Everyone, I think, was familiar enough with the injuries and the possibilities of treatment at that time, the options, that they knew what injuries Nelson sustained were fatal and not able to be addressed in a medical or surgical way. So no one blamed Beatty, and in fact, several years later, he published a very popular account of the death of Nelson, which is a big bestseller at the time because it described the final 3 hours of Nelson's life. In fact, he became then the head of the land naval hospital in Gibraltar for the Navy. So no, it just did the opposite. It just propelled him to virtual sainthood for taking care of this great hero.
One last question. What, in your opinion, is the greatest medical advance during that period? And this question is from Betty.
During this period, I think hygiene among the Army and Navy services was fundamental. The understanding that education was absolutely necessary for establishing good medical practices, whether in civilian or Navy, Army sectors. I think the introduction of fruit juices for scurvy was a huge medical advance that all lists include when it comes to medical advances. And remember, this was about 45 years before the invention of anesthesia and nearly 100 years before bacteria were proven to cause infection with the subsequent antiseptic techniques. So during this time, as I said, it was the cusp of medicine and surgery, the cusp of great new advances, but they weren't still quite there yet in this period of time. So it was advances in hygiene and education, I think, that were predominant.
And thank you so much for providing this talk.
Thank you.